What can happen if you get too much or too little anti-wrinkle treatment with botulinum toxin? In Ireland, this is a prescription-only medicine, and you have to see a doctor or dentist to assess your suitability, and they have to administer the treatment. For people who are new to injections, we generally go with a small dose and we review 2 to 3 weeks later, and you can always add more or tweak the dose if you need to. But if you go in heavy-handed and add too much, you can't take it out 2 to 3 weeks later, and you've got to wait for those effects to wear off. So one thing I'm really cautious of is in middle-aged women like myself is not to over-treat the forehead or the frontalis muscles here. We need our natural lift to keep the brows up, and if too much is placed here, the brows get really heavy and it feels like there's a pressure on the forehead, and it does wear off, but it's something that's avoidable. Another which is less common is when you're treating the frown lines or glabellar lines here. If some of the medicine goes from this corrugator muscle and goes into a muscle here called levator palpebrae superioris, which lifts the eyelid, you can actually get a drop of the eyelid, and that's called a ptosis. And that really doesn't look attractive. And there are some eye drops called iproclonidine on prescription again that can be used to help lift that, but it wears off. But we want to avoid that. If we were treating crow's feet lines here, it's really important to stay superficial and not to come too far out or too deep, because you can hit this muscle here that goes from the cheekbone down to the corner of the mouth called zygomatic major. And that helps us to smile. And if I were to over-treat that, the smile is distorted on this side and it pulls down, and the smile lifts up on this side and it's asymmetrical. So even if crow's feet lines are very extensive here, you can't bring that toxin too far out or you risk hitting zygomatic major. Again, as we age, the white roll or white lip here gets longer and longer. And if I was treating lines there, I've got to be very cautious not to put in too much, or I could lengthen that white lip. When somebody smiles, they can't show any of their top teeth. The same can happen if you're treating a gummy smile where somebody's got a lot of gum on show, and if you put in too much, you drop that lip too much. Another one is if we're treating chin, little crinkledy skin there called a pebblestone chin or cobble chin, we're treating mentalis muscle, and that muscle is not far from another muscle here called depressor labii inferioris. So that depressor muscle basically pulls down the lip, and if I hit that inadvertently, I'll stop that muscle pulling down, and when somebody smiles, it'll be higher on the side that's been treated and lower on the other side. Also, if you treat lines around the lip, you can affect how somebody sips and whistles, and that's a treatment where we do a lip flip, and I never do that in people who play musical instruments for a living, because they absolutely rely on that mouth seal, and if you affect that adversely in any way by catching a couple of deeper fibers of that muscle, you'll distort their lip seal over a couple of months, and we really don't want that. So I think in general it's a very safe treatment in safe hands. Another treatment I've seen somebody with a side effect from who came to me who'd had treatment in London was somebody who'd had their masseter muscles treated here for grinding and for muscle widening, and the injector had come too far forward and had hit a little muscle here called risorius, and again had distorted their smile. These are really preventable issues. Oh yeah, another one which is interesting, and I've seen it a few times in people, is what we call a Spock effect. And so again, somebody's treating the forehead muscles here. They've missed out all the lateral fibers here because they've been taught in their course that that's a danger area. It's not if you're very cautious. And so they've left this area untreated. This all gets treated and this pulls up. And that's not an attractive look either. And you can balance that if somebody's had it by putting a little bit of toxin here and here to stop that pull up and round it off a little bit. So the point of this is really just to say that side effects are possible. In really experienced hands, they should be incredibly rare, because these are really related to the dosing and the anatomy, and our faces are all very different. And what's fascinating for me is I've been doing some of these treatments since 2007. And when you're trained initially, you think, oh, that's really simple. It's 1, 2 or 3 areas and you can't go wrong. But actually people's faces are so different. And the face has this beautiful orchestra of movements where when you treat one muscle, you affect another muscle in a different area. So you've got to kind of create that whole symphony where you know exactly where you're going to treat and what effect it has in that muscle, but also nearby and distant muscles. That's the beauty of it as well, is you can really get more and more skilled at it and get a really individualized, bespoke treatment. So if you're considering treatment like that, please try and see somebody who's experienced and who's going to give you the best result. Take care. Bye.